Hi, I'm Dr. Jensen of Cedar Park Premier Dentistry. Let's talk a little bit about white or tooth-colored fillings. Tooth-colored fillings are a very hot topic in dentistry, and we get many inquiries every day here at our office simply because most of us are walking around with a bunch of silver fillings in our mouth. Some of the issues that we see with those old silver amalgam fillings are that they leak. There's always a little microscopic gap around the edge of the filling and where it interfaces with the tooth for bacteria to leak underneath and cause what we call recurrent decay, or basically a cavity that's forming underneath the existing filling. Another situation that we often see is that these old silver amalgam fillings expand and contract microscopically inside of the tooth structure, causing little microfractures around the tooth. Well, as you can imagine, eventually something has to give way, and the tooth structure eventually gives way, causing a fracture. Well, once the tooth fractures, then it can turn into a much more costly situation than simply having a filling redone. Sometimes it can turn into a root canal or, at a minimum, a crown. The process for removing these silver fillings is first and foremost diagnosis. Does it need to be done? We're not going to tell you here that every silver filling that you have has to be redone, but if we see that it's defective and needs to be redone, we will let you know, and then we will move forward with treatment if you decide to move forward with treatment. Once we move forward with treatment, the process is as follows. It's basically like getting a cavity done. We remove the old silver filling with a drill, clean everything out, clean out any decay that may be underneath the existing filling, and then we place the new tooth-colored filling into the tooth. So several of the benefits of having tooth-colored fillings placed are that, first and foremost, they are aesthetic. So you don't have a mouthful of silver when you're talking and laughing. Secondly, by removing the old silver amalgam fillings, we are also removing the disease process that is occurring underneath, so you have a disease-free tooth. And lastly, these restorations are bonded to the tooth, pulling the tooth back together, enhancing the strength of the tooth. So, if you are considering having your old defective silver amalgams replaced, check in with us here at Cedar Park Premier Dentistry. We will make the process very easy.